Hello, my name is James. I'm a Sierra Pacific University nursing student, and I would like to ask you a few questions just to enable me to take care of you. How are you doing today?
I'm doing good.
What's your name?
Marion Smith.
Do you mind? What name do you like to go by?
Marion.
Marion. Good to meet you, Marion. What brings you to the hospital today?
Well, I've been having trouble with urinating,
Uh-huh.
and it seems like I've been going to the bathroom so often.
Okay. When did that start?
It started yesterday, which is now getting worse. I had to go to the bathroom every 2 hours and have a problem with my abdomen.
Um, is there anything that you do that makes it better?
No.
No. What makes it worse? With the pain, you mentioned you have some pain. What makes it worse? Or when is the pain there?
It's only when I'm going to the bathroom urinating.
Okay. Would you describe the kind of pain?
It feels like burning.
A burning pain? Okay. On a scale of 1 to 10, 10 being the worst pain, what would you say it is?
Maybe about a 9.
9? Okay, thank you. Could you point where the pain is?
It's in my lower abdomen.
Lower abdomen? Okay. Does the pain seem to radiate or shift?
No.
Or so it stays pretty much on your.
Right.
Miss Marion, have you had this kind of problem before?
Yeah, about 2 years ago.
2 years ago?
Similar kind of problem happened.
Okay. How did that? How did you resolve that?
I think they gave me some antibiotics.
Antibiotics.
Bactrim, maybe.
Bactrim. Okay. As far as your understanding is, what do you think makes it better?
Drinking fluid.
Drinking lots of fluid.
I took 2 Tylenol, which seemed to help.
What's your understanding of this? What do you think is causing this pain, as far as you can tell?
I don't know.
Okay. I'm going to do a few tests just to kind of help me as far as your assessment. And please bear with me. Part of it has to do with looking at your breast and then a pelvic exam. I'm just going to describe to the camera what we're going to do. Is that okay?
Sure.
All right. So with the patient's permission, I'm going to ask the patient to, when she's disrobed, I'm going to ask her to raise her arms. Go ahead and raise your arms. I'm going to check the symmetrical of the breast. I'm going to look at the contours. I'm going to make sure that there's no dimpling, no plaquing, no orange peel. Now, I want you to place your hands over here. And again, checking for skin consistency. Everything looks symmetrical, no dimpling, no plaquing. Go ahead and lean forward. And once again, when she's disrobed, I'm going to make sure that everything is symmetrical and even. All right. The next thing I'm going to ask you to do is to lay on this bed. I'm going to use this. Go ahead and lay on the bed.
Legs where?
Legs there. And what I want you to do is to place your hand on your forehead, like that. And I'm going to inspect the breast just visually without touching. And then the next thing I want to do is to palpate from the axilla all the way down to the brow line, and then up again, making circular motions, and even all the way to the clavicle, and then down again, circular motions, feeling for masses, indurations, nodules, and then I take it all the way to the areolas. And then at that point, I'm going to ask her to bend your arm and then place it over here. And then I'll start from the areolas. I'll go down to the brow line, up again in a circular motion, feeling for any masses, all the way to the clavicula, and down again up to the mid-sternum. And I'll do the same for the left breast. Similar fashion, just feeling for irregularities, any discharge from the nipples, that kind of thing. Thank you very much. You can sit up. The next thing I want to do is to explain to the camera what we are going to do as far as how to examine the pelvic. The first thing we do is to ask for permission from the patient, and once we do that, we wear gloves, wash our hands, and place the patient in a lithotomy position. And once we do that, we explain to the patient what we're about to do, which is just examining the pelvic area. The pelvic area. I'll have all my tools ready and specimens in case we need to get a specimen. One of the things that we like to use is a speculum, and with the patient in a lithotomy position, I will just visualize the external genitalia. That includes pubis manis, the labia majora, labia minora, the clitoris, the urethra, and I'll go ahead and place my hand just so that she can familiarize herself with how it feels, and I'll very gently pick up the speculum that has already been pre-warmed in warm water and lubricated by the water, and I'll carefully place my left non-dominant hand down on the vaginal wall, and then place the speculum in the tubercle of the vagina, and I'll direct it until I can see the cervix, and I'll open it, and when I can see the os of the cervix, then everything will be right there. I'll inspect the walls of the cervix for erythema, for discharge, for any odor, and while it's open, I'll pick up the brush, the speculum, and I'll scrape 360 degrees around the ectocervix, and then I'll place that down, and then I'll take the brush and I'll scrape the endocervix for chlamydia and gynecological bacteria such as gonorrhea. And then when that is done, I'll carefully unlock the speculum and gently retract it as I inspect the external walls of the vagina, inspecting for erythema, inspecting for discharge, odor, any deviation from the ordinary. Once I do that, that will pretty much conclude the inspection of the external and the vagina itself and the cervix. The next thing I want to do, if the woman was over 50, in this case she's not over 50, she's only 36, but if she was over 50, I'll do what we call the rectal vaginal exam, but in this case that is only indicated for people who are females who are over 50, who you suspect may have cancer, and so in her case it's not indicated. What I forgot or missed to do is, while I'm in there, I'll again palpate the abdominal, the suprapubic area, and with my fingers inside, I'll palpate for the ovaries and actually shake the cervix and see and check for tenderness. I'll ask her whether it's tender. In this case, if it was negative, she'll say she does not have any pain. That concludes the brief introduction of how to do the examination. Thank you so much, Jen.
Marian.
Marian.